Yeah, I would say every life matters,
Yeah.
It doesn't matter what you've been through or what's going on. In that moment when we're involved, they need help, whether it's they have trouble transferring, right? We have an amazing piece of bed called the Independence Bed, which is a memory foam hospital.
Hi, welcome everybody to the Elder Care Insights podcast by Welcome Back Home Care. Today we have a great episode. We have our guest, Brett Feldman with Number One Medical Equipment and Supply, and Mark, the co-host here. And so we're very excited to get this started.
So Brett, so you are with Number One Medical Equipment and Supply Company. First of all, how'd you guys become number one? How did that? Was there a competition? Was it a?
When you feel so confident about what you do, you can just name yourself as
number
the top.
One.
Yeah, no. Realistically, it's though because of directories in our healthcare industry. A lot of things are alphabetized, and we wanted to make sure we were on top of those directories.
So tell us a little bit about Number One Medical Equipment and Supply Company. What do you guys do?
Yeah, so at Number One Medical Equipment Supply, what really we focus on is making the homes both medically functional and also beautiful. There's a lot of traditional durable medical equipment out there. Medicare is really behind the times on new technology, and we try to explain to our clients really what can make that home more effective for them so they can live there longer with great home care services like Lee's.
You accept that's through Medicare, correct?
So again, Medicare is really behind the times. So Medicare, let's just take a wheelchair, for example. When you get a wheelchair from Medicare, you're going to get a 30-pound just clunker, right? It's like having like a car from the 70s. It's heavy. It's hard for the caregivers to push them. It makes it more difficult to get in and out of cars. It makes a lot of people homebound. So one of the brands that we distribute for is something called Feather, which is the world's lightest chairs. Our manual wheelchairs are only 13 pounds versus 30.
13 versus 30.
Yeah.
Wow.
So, and our electric wheelchairs are only 33 pounds. The Medicare ones weigh close to 80, and you see them like strapped to the back of cars, where ours just fold up like a normal chair, only 3 pounds more than a manual, goes in the back of somebody's car. So it's really about just making the home medically functional and beautiful, but also allow people to get their independence back, not be stuck at home. And no, these items aren't covered under Medicare because Medicare hasn't really taken the time yet or has the time to go ahead with PDAC coding, which is what they use to go back and say, this chair is good, this chair is not good, this is what we'll cover, this is what we won't cover. Realistically, private pay and also long-term care policies are really the only way to cover them. Most people don't know this, but 85% of policies have a medical supply benefit, which most of the time just goes unused because nobody's really looking for the add-ons. They're just looking for the one thing that they need at that moment.
Yeah, and if you ever want to check into your long-term care insurance policy, call me. We do those type of consultations. We'll call the insurance company. We'll find out, is there a medical supply benefit, which is also known as a...
So there's a couple different things. There's a medical supply benefit. There's also a home modification benefit. So if you need ramps or grab bars, those sorts of things, we do that as well. And then alternatively, there's also something special called an alternative plan of care benefit. And you can really go ahead and petition your long-term care companies for just about whatever you need to, live effectively.
Yeah, I just called yesterday and we found out that one of my clients' benefits are also a medical alert supply benefit that she's been paying for one all these years, and now she realizes that she can tap into her benefits and not have to pay that monthly payment anymore. She didn't even know. So it's great.
It's funny because I for years I paid for my parents' long-term care policy, and I never knew. I mean, I know I bought both of my parents electric wheelchairs and all this. I never knew that this is very important. That people don't realize that.
Exactly.
These policies cover that.
Yeah. And things like what you're saying is a life alert. The life alert's a brand. Those pieces of equipment are actually called personal emergency response systems.
Is there an acronym for them?
PERS, PERS. And we
felt like it needed it.
No, it does.
Yeah.
We vendor for, and we actually have we do consulting work for a great company called Personal Living Alert. David Michaels.
Yeah.
Phenomenal product. Has both a in-home product as well as a watch. It's really great. Really, realistically, a loved one's not going to be completely alone. If they have that fall, they may be found immediately through 911, not be stuck there overnight on the floor. Then you go into things like compartment syndrome, a lot of really difficult things that leave people in hospitals for a long time.
Yes. Some of these life alerts or the systems, they're near the bedside table. How are you going to get to this thing when you fall in the shower? You want to have a company like David Michaels, who we know from the ESRN networking group,
Absolutely.
a great group where I know Brett from also. you want to have a watch or a pendant, something around you where you can be safe at all times.
So what? So like, if you fall or something like that, something on the watch, you just kind of
it's actually it goes with you, right? Most
Right.
of these personal emergency response systems are only for the home. His is one that actually will go with you like a watch. It's all GPS coded. You have that fall at Publix, you can still push that button, and EMS comes to you.
at home, at Publix, anywhere you are.
Yep, and we're a vendor for them at Number One Medical.
I know how beneficial it is to have a working, functional, good wheelchair. Because working for my brother's company, that's always on-time transportation. I was a driver at some point before I started this Welcome Back Home Care. And I know the difference between a clunker or one of those on-the-go chairs, a mobile chair, and it just makes the world of a difference. That 10 pounds difference, you can tell that's a nice wheelchair, that's functional. These people are comfortable in these chairs rather than the old style chair where it's like, most of the time the rubber's worn out already, and it's an extra line of safety. And that's what we're all about. We want to keep everybody safe, especially the elderly who need a little extra help. So that's what we're here for.
Where are you from, by the way? Let's get to know you.
Right. So
Where
I'm
are you from?
originally from New York, Long
Okay.
Island, just
Yeah.
like every good, Jewish New Yorker. I was
Right,
part of
Mazel
the
tov.
Exodus, where
Right.
when your parents retire,
North
they
Shore
make you sell
Hospital
the
here.
house. Me too.
You moved to
Came down here. Actually,
the sixth borough.
I was actually at Tulane University, and Hurricane Katrina
Green
hit.
Wave.
Go Green Wave.
Green Wave.
It's actually fun for me now because after Hurricane Katrina hit, I finished up at FAU, and with them both in Conference USA, I actually get to go to games with both of my alma maters at once.
And who do you root for?
Depends who's winning.
Okay, all right.
Recently, I referred Brett, a client who this young lady. She's the only child. She's super worried about her father, who's in a facility over community in Delray Beach, and she says, "I'm so overwhelmed. No one's helping me. I don't have anybody in my corner. Do you have an attorney that can help me with Medicaid?" And I handed Brett's card over, and Brett works for a law firm, which is called Elder Care Solutions. Is that it?
Elder Legal Solutions.
Elder Legal Solutions. Okay.
Yeah. And what the great part about our firm is actually all of our attorneys are accredited with the VA. So we're able to utilize a lot of the trust and different things that the VA allows us to do to help people get both aid and attendance benefits, which is an amazing pension benefit that any wartime veteran is allowed to get that can give them realistically up to about $2,600 a month towards their care. And additionally, also to help them get on long-term care Medicaid, which is also known as the Home and Community-Based Service Waiver Program. That benefit is just unbelievable. It can do 4 different things for a family. It can either help them with adult daycare. It's the benefit that will pay for a nursing home in full, minus your share of cost. It'll also cover about $1,700 a month towards the care costs at an assisted living, or pay for home care services.
This is a lot here. So any veterans out there, any veteran spouse out there, please give us a call. If you have any questions about this aid and attendance benefit, it's very in-depth, and it's not that complicated, and Brett's firm helps to simplify the process.
Yeah, we have some amazing attorneys, Neil Rice, Tamara Tadros, a few others, and they do a phenomenal job. We meet with every client. Consultations are completely free of charge. There's a lot of misconceptions out there, and what we try to do is maximize their availability to benefits so that they can really afford to live where they want, get the care that they need. It's just it's important when we can take somebody who maybe is only getting $1,200 to $1,500 a month in Social Security, and we tap into both of those benefits. Now they're getting an additional $2,600 a month from the VA, $1,700 in care costs from Medicaid, and that makes a hell of a difference when we're thinking about maybe assisted living, because now their budget is $5,800 versus $1,500. I mean, we're
That's a
changing
different
people.
life.
It's a different life. It's a different community. It's a different style of living, and it's a safe style of living.
So let's talk about those misconceptions. One that's on the top of my mind is you have to be poor to be on Medicaid, and that's false. Correct, Brett?
Completely false.
Enlighten us a little bit.
So it's more about how you protect your assets. Medicaid doesn't show up and take all your money. These are all like things that everybody gets scared about when they hear the word Medicaid. Medicaid's a tool. Medicaid is the thing that helps us get us more help than we can maybe afford. And, a lot of people just think it's, food stamps and a lot of other things, but it also acts as your secondary insurance. So there's also the MMA, or Medicaid Managed Assistance Program, through the statewide Medicaid Managed Assistance Program. Love repeating myself. But
easy for you to say.
I know, right? So I'm also a licensed insurance agent, and we have number one health and retirement solutions.
Another hat. Yeah.
And realistically, we're working with a lot of seniors, but also people under 65. But when they turn Medicare age, the question comes on, do we go on an Advantage plan? Do we get a secondary insurance and stay on traditional Medicare, which also gives you a lot more control? Medicaid acts as that secondary, picks up that extra 20%. So a lot of times those people can't afford the supplement, can still stay on Medicare. We can get them on Medicaid and the long-term care Medicaid, and they keep control of their health care versus giving it to a managed care organization.
Great. That's a lot of stuff. So basically, we spoke about the VA aid and attendance benefit. We spoke about Medicaid and the managed care plan. And you don't have to be indigent or on the streets to get Medicaid. It's a tool, and that there's certain strategies to go ahead and manage those strategies. One is a trust, for instance. And Brett, you can probably tell us a little bit more about that.
Yeah, I mean, not a lawyer, right? So don't want to give away legal advice here. But Neil, Tamer, our team are the best at this. There's different types of trusts. There's irrevocable trust. There's revocable trust. There's veterans trust. Everybody's situation is different, right? So every time we talk to anyone, it's a puzzle. It's a puzzle that we need to solve. So, I'm not going to help Lee like I help Mark. I'm not going to help Mark like I help Christian over here engineering. Every life that we touch has a different story. They have a different need. They have a different understanding of, and our job is to understand their situations and then help them the best way that we can.
Listening is always key. I'm always doing my best to empathize with clients, listen to their story, and then at that point become the authority and tell them the next steps to take.
Who would need the Elder Legal Solutions? Who tell us about who?
You know what?
Who's your
Honestly,
customer?
everyone.
Yeah, everybody.
Anybody and everybody could be, our customer, because a lot of times we're helping young families. They just had a kid. They want to do their wills.
Right.
They need to set up a trust where they put their house. They want to, they want to make sure that their children are protected. They need power of attorneys now and healthcare surrogates and living wills. And we go to them. They can come to us, but we can also go to them, which is a really nice thing that we do that a lot of firms don't do.
So the name is Elder Solutions, but you still could you help people even in their 20s, 30s, just like my son's 31 years old, about to get married and whatever. I guess he should be contacting you guys as well.
He's probably not thinking that now he's getting married and he has a wife and he has kids, and what am I going to do to protect them? Well, maybe down the line.
Oh my God, I have grandkids?
Well, maybe not yours. I mean, I have two little ones, you know, so when the day came that they were coming to this world, it was my time to start doing my planning, right? I don't want something, God forbid, to happen to me. And now what? It goes into courts. We're dealing with probate. We're dealing with guardianship then. All these things that can be figured out way ahead of time.
Right. So, that they need to know who's something. God forbid something happens to them or whatever. How are they going to? How are these kids going to be taken care of? Give them to grandpa. And
what's the old saying? Those who don't plan fail.
Right.
So planning isn't something. Yes, is our firm the majority of the time in crisis? Right. We get so much of our clients are there in crisis because they haven't planned.
Right.
If you're ready to plan, though, we can do that. We can do full estate planning. We can go ahead and figure out the right solutions, both short and long term. I'm going to go back to the insurance side of this. Most people don't realize, but a lot of times, for your newborn child, everyone's healthier today than they are tomorrow, right?
Sure.
So your premium costs are low. I mean, one of the best things my parents ever did for me was take out a whole life plan that allowed me to lock in my health rating. But every 5 years, I get to add to that policy at the same health rating as if I was 10 years old. And these are things that we can do for people.
Right. And I guess people need to know that. The quintessential example I always remember is Joe Robbie, the original owner of the Miami Dolphins.
Yeah.
He, you know the story. He died without a will. He was he had owned the stadium. It was one of these, what's the municipality? He owned the entire stadium and everything. His kids got nothing because
unbelievable.
They did no estate planning whatsoever.
Right. And I mean, this is, my background's actually what Lee does, and he does a phenomenal job with the caregivers in the home. I did it for 10 years. And what I did during those 10 years was I was the person always referring business out to lawyers, to insurance agencies, to durable medical equipment companies, pharmacies. So when I left doing that industry, what I wanted to do was build something that was vertically integrated to be almost like a home care's best friend. And a lot of times these home cares, what they do is they utilize care management services. And there's great ones. There's Unicity Senior Advisors, there's Stacy Ruskin, there's just so many. But those care managers also need a resource, right? So, when you hire a care manager, they're still now responsible to be calling 4, 5, 6, 7, 8, 9 companies.
Yeah.
But what we're building is
transportation, medical equipment, home care, doctors, bill pay. There's so much involved with this, and
right, and that's kind of what we're doing, is building this integrated network of vertical companies that can support care managers and home care companies, and that's what we do.
Yeah. So with Welcome Back Home Care, our tagline is anticipating your needs since 2014. So essentially, that's what we're doing. We're anticipating your needs by having the resources around, by planning, by knowing what to do and how to call the insurance companies and figure out what's in that policy, find out the daily benefit, because most people have the policy, or if they do, they haven't looked at it. It's been in the desk drawer at the bottom collecting dust. So I go ahead, get on the phone with the client, and we conference in. They give us permission to talk, and we find out about what's the cash value. Is there an elimination period? Is there a waiver of premium? There's lots of things we talk about, but mostly we're anticipating the needs for the future, and that's why long-term care insurance is a great idea, or life insurance with a long-term care rider, because like what Brett alluded to, we're always healthier right now. So the younger you are, essentially, the less expensive it's going to be.
Exactly. And there's a lot more benefits out there that people don't know about. And that's kind of what we're trying to do, is uncover them. I mean, one of the biggest things is we're primarily dealing with homebound people. But there might not have to be homebound. They might be home dependent, but not homebound. So things like your doctors, people don't know this, but under traditional Medicare benefits, you're allowed to have a physician come to your home to take care of you. You don't have to still be, struggling to get out to the doctors. One of the companies that, we consult with and work hand in hand is a company called Doctors House Calls with 20 ARNPs.
Dr. Seth.
Well, Seth isn't a doctor, but...
Oh, okay, all right. Well, he's out in the networking group too.
So the principal owner of that company is a gentleman by the name of Adam David. And we have clients everywhere from South Miami to Vero Beach that we go ahead and we go out to the home with ARNPs and with physicians and take care of them. Actual physicians. And it's covered under your Medicare.
Wow.
Yeah.
Wow.
Yeah, we've worked with companies where the client declines a bit, can't go to the doctor. We'll call a certain referral partner, and they'll have a doctor come right out. It's covered by Medicare. Unbelievable. A lot of people don't know this, that Medicare is super involved. There's so many different benefits through the Medicare. Brett's pretty much an expert at this.
Yeah, it's all about peeling back the layers, right? So a lot of times somebody's getting discharged. I had this one amazing family, and they just got discharged out of a skilled nursing facility, but they didn't have the proper orders. And they couldn't afford some of these equipments that we do at Number One Medical Equipment Supply. So we had to, utilize our sister company, Elite Medical Supply, who's, our Medicare arm, and get them all these great items that they need. But we need the orders to do it and the notes to back that up. Mm-hmm. So Doctor's House Calls went out. That was done. We got them the equipment the next day. They also needed their home health benefits through their Medicare home health. We partner with Trilogy.
Yeah.
Phenomenal Medicare home health
Trilogy is
agency.
one of the companies we work with many years.
Yep. Trilogy, Accessible Home Care is an amazing company as well. There's so many good ones out there.
Yeah, I'll give a shout out to Working Nurses. They're just so terrific.
Yeah. Jamie
working with
and
a lot of
great.
the folks over there.
Yeah, there's so many good ones.
Clearly, Brett and I, you can reach us. We have lots of resources, lots of connections. We like to give 3 or 4 different business owners the opportunity and the client to choose. See who you feel really good about. We clearly have a lot of different resources.
Which is funny, because I was just going to say, as a layman, I don't know about any of this, but I'm seeing this is kind of cool that you guys all, no one's a competitor in this. You guys kind of all work together. You all kind of have, and it's all, I guess if anybody were to call you, Lee, and they needed legal advice or medical supplies or whatever, you're going to go to Brent. I'm just kidding, Brett. Or
Fred. No.
Fred. Oh, and the same is true here. I'm sure somebody's coming in for a wheelchair, and obviously they're coming for a wheelchair. There's a good chance they might need
a caregiver.
A caregiver, boom. That's going back, and then and then legal and these nurses that come to the house.
You really have to build a
it's a team.
Exactly. Senior care is a community,
right?
And we have to build a community around every patient, and it's a circle.
Right.
Because, and the most important thing is working with people who actually communicate with one another. Because maybe we're seeing the home care is always going to see it first, right? That caregiver's there anywhere from 4 hours a day to 24 hours a day with Lee. And they're going to really see as things are progressing, or sadly not, the other side of it,
Right.
they're regressing. And a lot of times, a lot of the diseases we deal with, like Alzheimer's or Parkinson's, are progressive. By the way, always reach out to APDA or Alzheimer's Association. They're great organizations. They have amazing resources. But we go ahead and build that community around them and make sure that whatever it is on a daily basis that they need, they can actually get. And a lot of these seniors feel alone. They feel isolated, and we don't want them to feel that way. We want to make sure if we've ever been able to touch their lives and work with them on a day-to-day basis, they know that they're taken care of and they're protected. And those families do too, whether they're here or out of state.
Okay.
That's what we do it for.
So we don't want to neglect to make sure that we're honored to have you in your multiple levels of senior care and elder care. How does somebody needs get a hold of Elder Legal Solutions or Number One Medical Equipment Supply? How do they get a hold of you?
So obviously, I'm happy to give out my number. I'm always an easy point of contact to reach 24/7. That's 954-909-7526 or
one more
plan.
time, a little slower there.
954-909-plan 7526.
That's very cool.
So
909 plan.
Great.
That's kind of why we did it that way.
Yeah.
But if you want to look at any of these newer age technologies for durable medical equipment, you can go to the number one, medicalsupply.net. Our website for Elder Legal Solutions is elderlegalsolutionsllp.com. Or obviously, any one of the other companies that you need, you can always just reach out to us and we'll get you connected.
Sure.
So we have a little tradition here on Elder Care Insights podcast. And we just started this tradition on our last podcast.
Ooh,
okay.
I get to be number 2.
Tell us either from Elder Legal Solutions or Number One Medical Equipment and Supply. Tell us your best day ever. What was your best day ever?
There was this one family we were working with. It was a mess. It was truly a mess. They were going back and forth. Do we need hospice? Are we going to have mom be home? Are we going to have mom go to a skilled nursing facility for rehab? Do we stay in the hospital longer? Do we appeal this discharge? What is it, right? Like, what do we do? And I get to the room and everybody's trying to keep a straight face. We get in the hallway, everybody just is breaking down in tears, right? And I literally spent 5 hours with that family. And we went through every piece of the puzzle. We got their doctor situated. We got their benefits situated. We did the consultation with the lawyer right there on spot. I actually sent teams out to the home to start doing their medical supplies and build ramps and a pool lift all within 5 hours of ourselves. And this lady who, there was a good chance that she was never coming home. 48 hours later was home and didn't go on hospice. She actually lived for over 2 years.
If something would talk about like something that we don't do in this country as they do better in other countries is we need to take better care of our elders,
Absolutely.
of the ones that have the wisdom, and we don't, and it seems like you guys one business at a time, one client at a time, one patient at a time. You guys are all you're a little community, which I love being on this podcast because I feel like in a small way I'm part of this community now. Is like you guys really seem to be taking care of people in their time of need.
Companies like Brett, companies like mine, we care. You can see a bit of our passion. We're not going to stop until we know we're doing the best that we can to make sure that citizen is protected and we're creating longevity for them to have a good quality of life and to preserve their dignity.
Right.
And to keep it going and for them to have socialization. They can get out. They can go to their beauty salon or the Dunkin' Donuts they love to go to. So all these things with the medical supply and caregivers, that all helps them live a good quality life.
Yeah, I would say every life matters,
Yeah.
It doesn't matter what you've been through or what's going on. In that moment when we're involved, they need help, whether it's they have trouble transferring, right? We have an amazing piece of bed called the Independence bed, which is a memory foam hospital bed that converts to a lift chair.
Wow.
That's pretty cool.
And so a lot of times
Yeah.
for people who let's say they're in a studio apartment, it doubles as both, right? So they don't have as much space when they move to assisted living. And we also have those ones that, I'll be honest, are just a little bit vain and need something beautiful. And we have something great called the Sondercare bed, which looks like something you'd find in Restoration Hardware, not a medical supply store. Gorgeous ergonomic wood frames from Germany, Tempur-Pedic mattresses, custom fabric packages out of Canada. I mean, it's beautiful, like something that anybody would be happy to sleep on, but it is a hospital bed and
medical
has
equipment
functionality.
can be beautiful. And before we wrap this up, I wanted to touch on one quick thing. So Medicare, what we do is we will call and we'll check in on our clients and we'll see, has there been any falls lately? Has there been any decline in vision? Any decline in their audio skills? And so at that point, physical therapy, for instance, is covered by Medicare. So there's many other things. If you have a wound on any part of your body, it's covered by Medicare. You have a nurse come out and start to do wound care. So these are some of the types of things that are covered. And maybe there's lots of other things. Brett, please expand on a few others.
I definitely would stress occupational therapy. Mm-hmm. A lot of times we give them this equipment, but they need to know how to use it. And having these Medicare home health companies, the ones that we mentioned, go ahead and come out with physical or occupational therapy and really go ahead and focus on how not just, well, you have this new bed, but how do you use the bed? Or there's something called a dignity lift, which is actually a lift for the toilet. And a lot of people are incontinent because they can't actually, depth perception-wise, get on and off a toilet. And this actually will lower you down and raise you up. And we give back dignity that way. Nobody wants to be incontinent. Everybody wants the toilet. Everybody wants to walk, and everybody. But we have to figure out what they can and can't do, but then make it easier for them.
Yeah, so speech therapy for stroke victims, just practicing and continuing to get those motor skills, and Medicare is all encompassing. There's lots of other things. So give us a call at Welcome Back Home Care.
I just got
Sure.
one other question.
Yeah.
So somebody contacts you and they want to know if they have either the studio apartment where they have the bed that converts to the chair, or they want the Mac Daddy one. Is there a way that they could see these before they purchase it? Or?
Oh, absolutely. So we have a showroom in Deerfield Beach, right on the corner of Southwest 10th
So they
and
can see
Federal.
all this stuff at the showroom.
Yep. We also have with Elite Medical Supply, our
Uh-huh.
Medicare sister company over there in Lantana. So we have that as well. Also, we can go online, and then also through our company, we have a separate side company within the medical supply space called Functional Living. And we're actually going to be going ahead and staging some apartments in some different assisted living communities. So you can both go on a tour there, but also see all of our equipment.
So it's like a interior designer for elder care.
Exactly.
Virtual walkthrough. I'm sure that...
No, physical.
Physical walkthrough.
Yeah. That's
Wow.
amazing.
Yeah.
So also tell us how we get a hold of Welcome Back Home
Sure.
Care also.
Check us out at welcomebackhomecare.com. Give us a call at 561-279-6400. We're serving all of Broward County, all of Palm Beach County, and the Treasure Coast. So that's 561-279-6400. Just call us. We'll help you. We'll answer some of the questions you're looking for. We can refer to great people like Brett and other great companies as well. That's what we've been doing. We want to be resourceful, and we definitely want to help you. So please give us a call. We care a lot.
Awesome. Guys, thanks. Brett,
Yep.
thanks for being.
Thanks for the time. I
And
appreciate
thanks for
the
watching
opportunity.
the Elder Care Insights podcast by Welcome Back Home Care.